very distinguished social science researcher with us today, Dr. Marie-Christine Cormier-Salem. She leads the Agropolis Foundation, which is coordinating efforts across several major scientific institutions. She's a senior researcher with IRD, the French National Research Institute, has played a leading role on IPBES, has published literally hundreds of scientific articles, dozens of books. Really great to have you. She's going to talk a little bit about Prezode. Her research interest, though, is what I would really like her to come to, which is on a really key part of this that Nicole certainly talked about it, but is so important to all of this, which is the issue of equity and justice. So tell us a little bit more about Prezode, and then share some perspectives on the justice and equity dimensions of pandemic prevention, please.
Thank you, Nigel. And so many has been already said, and it's difficult to add. It's really an honor to be here on behalf at IRD. And a few words of introduction. As social scientist and director of Agropolis Foundation, I would like to emphasize two key issues. First, to engage scientific communities also suspect about responsibilities, the responsibility of a scientific community in transformative research to address our transformative world. That means sustainable science, interdisciplinary and transdisciplinary research for co-design sustainable, equitable and desirable solutions. And that means favor place-based or local-based solutions, but also fosters a dialogue between science, policy and civil society, and the mutual confidence and innovative co-learning and training. You are right, we have also to insist about training of the next generations and to really de-silo and transform to make revolution the training of the next generation. And the key challenge, we speak about connection, it is integration, articulation from local to global scales, and interconnection between stakeholders. Yes, let me introduce the Prezode initiative. It's fully in line with this challenge of co-building linkages, and linkages its power. And our state secretary has said a few words on Prezode. You know, all of us, that Prezode has been launched by President Macron in January 2021 during the One Planet Summit, and it has been deployed at an international level for preventing the emergence of zoonotic diseases. And it responds to this challenge by advancing scientific knowledge in support of decision making, the development of monitoring indicators and response mechanisms. It is an international collaborative initiative that supports the activities of the quadripartite. And the initiative was co-designed over 2 years through regional workshops encompassing 11 regions, and that brought together 1,800 scientists and stakeholders from over 120 countries. It's a huge process of co-building. And the aim was to identify the knowledge gaps and the operational actions to be taken. And these workshops allowed the drafting of the strategic agenda of the initiatives, the co-design of the roadmap for the next 10 years. And 2 priorities have been identified. First, strengthens One Health surveillance, animal-human interface, to rapidly detect emergencies and be able to stop them, and co-design ecosystem management strategies to reduce the circulation of microbes within ecosystems. And today, it's 18 countries that have signed the declaration of support for the initiative, and more than 180 institutions. Next step is the international takeoff with steering committee elections starting in January for international governance. And in terms of, going back to the importance of the One Health approach, it's an entry point and an opportunity to connect the three pillars of the CBD agendas. That means conservation, sustainable use, and equity. And this last pillar, it's often not invisible, but it's a bit cosmetic. That means that we call about, but we doesn't really address and embrace the complexity of this notion of equity, justice, equality. It is approach One Health. It is meant to designing and implementing programs, policies, legislation, and research links on environment, health, human health, and animal health. It supports efforts to avoid siloed thinking, which can often result in unintended consequences. And regarding the issue of environmental justice and equity, it is vital to agree the 2050 goals and 2030 targets related to conservation action at COP15. However, we will not succeed without acting on the multiple drivers of ecosystem destruction and biodiversity loss in one hand. That means reducing the drivers, reversing the loss, but in the other hand, raising local people, indigenous people and local communities and support and local people welfare, strengthening their capacity building, recognizing their rights, notably those of women, and upholding equity and justice. And scientific-based evidences from IPBES and the last assessment on sustainable use of wild species support that forest conservation is inefficient and unfair, and that is jeopardizes ecological and social connectivity. And would like to use another word, solidarity. Ecological and social solidarity are inscribed in the charter of the national park in France. It's very important. It is also transgenerational solidarity. So we need a healthy planet for the well-being of the people, for healthy diet, healthy food, and the application of the One Health approach is a powerful way to reconnect interspecies linkages, interconnection. Probably it's one of the key words of our panel.
Thank you so much, Marie-Christine, and thank you for being with us here. We're running out of time.